Thank you.
Okay. So, if I was going to reuse these ACE wraps, which I will, not on your face though, you might want to consider washing the extremity first. So I need to ask them about contraindications. Do you have CHF, congestive heart failure?
No.
Renal disease? Okay. Do you have renal disease?
No.
You don't have it?
What was that? What is
Very
it?
nice disease. I just was curious. Good. Nice strong pulses. Capillary refill is brisk, so I push down and I count 1, 2, 3, 4. It's already back at 7. It needs to be 15 or less. I don't see any open sores, which is not necessarily a contraindication anyway. What else? What am I missing? Anything?
Is he diabetic? Has he had
Low
any
pulse.
blood clots recently?
Very good point. Do you have diabetes?
No.
Okay, good. And do you have any pain with this? This is called Homenstein. You're going to learn about it next semester. When you dorsiflex and squeeze the calf at the same time, if it causes pain, that could be an indication of a blood clot. And so I should actually, I don't know how flexible your hamstrings are, but I don't feel any swelling in his calf. It doesn't feel extremely hot to me. And can you show me your calf?
Is this supposed to be ankle
No,
swelling?
let me look at it.
I guess so.
I don't see any redness, and he's not complaining of pain, so I don't suspect that he has a deep vein thrombosis.
Is this supposed to be for the ankle swelling? Is that what the problem is?
Oh yeah, let's give him a diagnosis.
Okay.
Sure, he has an ankle sprain.
Okay.
Okay. So I'm going to first apply it. We do have a handout for you, but I don't know that I agree with everything that it says as far as using this for compression. If you're simply using it for compression, remember you have to apply it from distal to proximal, and more pressure should be applied distally. Who can tell me why?
Most swelling?
For the heart.
Right. Very good. You want it to go up towards the heart. Okay. So first I'm going to form an anchor, which is just a loop. You don't want wrinkles, and you don't want perfectly round segments, because you're going to then cause estrangulation or lack of blood flow. So there are 2 different ways to do it. I'm going to show you the way that I prefer, and then unfortunately the handout has it the other way. But so I'm going to slant at an angle, and then when I come back, I'm going to slant in the other direction. If you try to make a really big slant, then it will end up wrinkling your wrap. So what position should his foot be in?
Neutral.
Neutral, or whatever it is that I am trying to gain or protect. So if I was trying to protect against, it's hard to do this and talk. Okay, you may want to come closer unless you have autofocus on your cameras.
I know, it's getting dark.
You're missing my beautiful basket.
You don't just do it once, you do a couple layers.
Well, why might I continue?
Oh, you need the strong pressure.
I need strong pressure, but also I need for it to move up, right, beyond just the spot that is swollen. So let's say he has swelling up to just above his lateral malleolus. I'm still going to wrap beyond that. And ideally, you should wrap all the way up to the knee. Now that's going to take a lot of wraps because Johan here has a long tibia. So I just picked up where I left off.
It's interesting. As many times as I've injured my ankles and so forth, I've never seen what his leg is resting on.
Yeah, I never have either. Like I said, this is the only place I've ever seen it. I think it's pretty cool. I don't know that I probably wouldn't carry it around the hospital with me, but
It looks so
it'd be nice to
professional.
have for outpatient. Thank you. Now, what do I use to secure it? You want me to keep going?
The
Tape, not the little metal clip. The little metal clip is bad, especially if it's somebody that's likely to be, that would have a hard time healing from an injury. So you might still see the metal clip used for a young athletic person, not with diabetes, absolutely not. Not with poor sensation. not with, not with an amputation. Absolutely not. The metal clip that comes in an ACE wrap packet,
They don't work anyway.
yeah, tape doesn't work all that well either, but it's not going to hurt the person. Usually if I have to do this for somebody that has had an amputation, when I open up the ACE wrap, I throw away the metal clip because I don't want them to use it and I don't want the nursing staff to be using it. We just use tape. Alright, so why does it look this way? So let's see. As far as the top, see if they can see the dorsal part of it. Why does it look, it's called a basket weave, why does it look like that? Because there is no round circular section. So if you get the crisscross, then you know that each layer is at an angle and you're not going to cut off the circulation. No, that's not completely true. If you do it too tightly, you still could cause some circulatory compromise. But I'm still getting a brisk capillary refill. So I'm pretty confident that I didn't wrap it too tight. Your toes feel numb? Okay. Alright. So you want to try it?
So what point?
Need to see it again from up close?
How did you? Yeah.
Is that the Gilby style that we would wrap somebody? Not the city, but there are other ways to wrap.
There are other ways to wrap. This one, starting distal to proximal, is good for compression. If you wanted to stabilize the joint a little more, you can use what's called a figure 8 method. But you're still going to get that basket weave effect.
So you're wrapping it around like this?
Is wrong. Well, lymphedema wraps don't necessarily have a basket weave pattern. They're not straight around, they're more at an angle, but they don't necessarily look like a basket weave, I don't think. I can show you the figure 8, but for compression, I want you to use the one I just showed you.
Did we have to wrap all the way up to the knee? Or
Yes, yes. Up to the knee, because the concentration of your lymphatic vessels, anywhere basically that your body flexes and is warmer than anywhere else. So, elbow. Oh, also anywhere where you can assess a pulse is going to be where your blood vessels are concentrated. Elbow, axilla, groin, popliteal, somewhat around the ankle. Okay, and then obviously in the center of your body, where all your blood vessels are.
Can you give an example of a way someone that wouldn't be in neutral position have to?
Yeah. So let's say he sprained his ankle like that. And so he's torn structure here, right? So then I would want to wrap him in a little bit of what? Eversion, dorsiflexion, right? I will tell you, the way that I do this at home with my husband is very different than I'm going to do right now. Can I have a pillow? Because you can use your body to stabilize things, but you still want to be sensitive about what part of your body you're pressing against. So this is the more professional way to do that. Okay, so I'm going to... So think about what you're trying to achieve. See, can you hold your foot in dorsiflexion? Thank you. Great, he's strong. Okay, so then you can continue in this fashion, or you can then go into the basket weave. So that's another way to... What happened? This doesn't seem... Did I put your foot up higher or something? You're going to run out of bandage a lot quicker with the basket weave method. But, so I anchored with a figure 8, and that can kind of stabilize around the ankle. You can also keep wrapping in a figure 8, and it'll stabilize so that it won't move so easily from side to side. So it'll protect that structure from being stretched again. Does that make sense? So if you wrap them in eversion,
then you'll wrap him to avoid inversion. Does that make sense? Okay. But let's just practice the compression one today. It'll take you a little while for your hands to get used to it, so.
After you did the contraindication, what did you touch? You like did a pulse and?
Pulses, capillary refill, check for warmth,
So
look
where'd
for
you touch the
edema.
pulse?
I'm gonna let you figure that one out. Okay, I will give you